New vaccine guidance by the CDC regarding the combined measles, mumps, rubella, and chickenpox vaccine. The American Academy of Pediatrics joining us this morning to explain their take on the new information. Dr. Annie Mlnarik is here. Dr. Mlnarik, thanks for joining us this morning.
Thanks for having me.
Sure thing. So the new guidance indicates children should receive 2 different shots versus a combined shot. What risk do children face if they do receive the combined shot? What has evidence shown?
So the measles, mumps, rubella, or MMR, and the chickenpox vaccines are given twice during childhood. The first dose is between ages 12 to 15 months, and the second dose is before kindergarten at 4 to 6 years old. And there are 2 ways that you can administer it. One is a combined vaccine, so 1 shot, where you can separate them and give them in 2 shots. And typically in kids under 2, we give it separated because when you give the combined vaccine, there's a slightly increased risk for something called a febrile seizure. The risk is already extremely low. So 4 in 10,000 children who get a fever after the vaccines will go on to have a febrile seizure. And if you give the combined vaccine, it goes from 4 to 8 children in 10,000. So it does technically double your risk, but the risk is already incredibly low.
And this is up to a parent, right, to choose whether they want the combined dosage or the 2 separate shots?
It depends on your practice. At my office, I just give it separate, but you could, at many other offices, discuss if they are prioritizing 1 less vaccine over that slight increased risk for a febrile seizure, then they often do have a choice at the first dose.
Okay, so doctor, there's also discussion over delaying the hepatitis B shot for infants. Are there studies that have shown this vaccine given at birth causes complications?
No, there are no complications from any studies seen that if given at birth that there's an increased risk for that.
Now, I know that some skeptics are saying basically that, well, it's unlikely that a child would develop hepatitis B unless they inherited it from their mother at birth. What are some other ways that a child could get Hep B?
So you're right. The most common way that it's transmitted is through mother-child during the birth process. Otherwise, hepatitis B is transmitted through bodily fluids. So later in life through sexual activity, IV drug use, if you work in the healthcare setting and you get a needle prick. But it's still very important to vaccinate all babies in the immediate newborn period because some moms are not aware of their hepatitis B status. There could be inaccurate testing in the prenatal period. And so it's a terrible disease that's 100% preventable if we vaccinate within the first 24 hours of life. So that's why the Academy of Pediatrics recommends that at birth.
And then today, President Trump is expected to announce a link between acetaminophen and autism, and a Mount Sinai hospital study confirmed an elevated risk. And then also back in 2021, an international group of scientists and clinicians recommended that pregnant individuals forgo acetaminophen unless its use is medically indicated. So what is your guidance for mothers to be in taking acetaminophen while pregnant?
So those studies that you mentioned, they show something called an association rather than a causation. And there was a larger, better study that was conducted in Sweden in 2024 that used something called a sibling control. And in that study, there was no association seen between acetaminophen use and increased risk for autism or ADHD, which indicates that those other studies may be confounded by maternal factors. And so as far as we know, I would say that it is still safe to use acetaminophen or Tylenol during pregnancy because untreated fever and pain can come with its own risk to the pregnancy as well. Obviously, consult with your OBGYN always during your pregnancy, but that would be my recommendation is that it is likely still safe.
All right, Dr. Mlnarik from the American Association of Pediatrics, thank you so much for joining us this morning.